here in sunny San Diego at the Privacy and Security Forum, where we caught up with attendees to hear more about the conference. So tell us about what sessions you came to visit here, and what are you looking to get out of the conference?
Most of the sessions looked very interesting and very relevant to me. The one this morning with the woman from the OCR was very interesting, talking about how audits and penalties and things like that are progressing. So it gave me a lot of information and insight into how that is going on. And then the session I just came from had to do with medical device security. And I manage information security and medical devices at our organization. So it was of particular interest to see the challenges other organizations are having, and that we're sort of all in the same place of trying to figure out the next steps. So it was very helpful.
So Jim, what were you expecting to get out of the conference? Why are you here?
Well, I really wanted to see what a lot of the hospital CIOs, what their concerns were, where they were having challenges, and really an opportunity to see them cross-pollinate and help each other, and it looked like a good opportunity for them to do that.
There's a lot going on. We've developed all these applications, and we're going towards digitization, but now the big game is to protect the consumer information. So that actually brings me here.
Myself personally, I recruit specifically within the healthcare field, with a focus primarily within privacy and security. Within the California region, we're based out of San Francisco Bay Area. So my vision for coming down here was to really, I guess, info gather and learn more on the industry from, some of the top talent and kind of specialists within it. And then also, an opportunity as we're doing here just to network a little bit more, with some senior personnel, just to also kind of put our name out there a little bit more, and the Real Staffing brand.
Oh, I think any conference like this, two good opportunities. Number one, to see what other people are doing, and as you hear from the speakers, often it's the same things that we're dealing with, and hopefully some of them have solved those problems, and of course to interact with the vendors to be able to get some of those ideas of how to solve some of our problems that we deal with every day.
Hi Erin, I'm with High Tech Answers, and we do a lot of reporting and blog posting about the issue of health IT security. And in fact, probably 30% of the content we do right now is around this issue. It's critical to both physicians and hospitals, and a growing concern given what's happening with all these breaches.
I've really appreciated HIMSS leadership through its working groups and committees, on the privacy and security space generally. And so I was hoping that this would sort of be an extension and representation of that work, and it has been. It's a great collection of the thought leaders within the HIMSS community, both vendor and provider. And so I really just wanted to sort of come and get a smaller conference perspective where it's a little more intimate.
So I was hoping to get a lot about best practices and what other people are doing across the industry. There are a lot of healthcare-related organizations here as well as outside of healthcare. So I find it very intriguing to see what everyone else is doing and how they're applying it and implementing it at their sites.
We have so many compliance issues in our hospitals, HIPAA compliance, things like that. So just getting the understanding personally of what I need to do, and then bring it back to my organization, and really get to the top level people who can really drive some of that stuff. In all honesty, they sent me here, which is the big change in our thought process in our organization. Usually, being an IT director, it's usually me warning of the security issues and things like that. But having my C-suite really understand what is going on with the compliance, the data breaches that are happening now, is really driving this whole gathering of information to roll it out. Because the risk assessments that are being required, it's a scary thing for them. When they hear the penalties and the costs and all that stuff, we want to get really on the ball with that.
The thing that I found the most valuable on the first day was Ileana Peters' talk about OCR and what OCR is looking for during their audits. We got notified recently that for address update, which kind of means that they're looking at us, not necessarily for a visit this time, but we're on the short list. So that was very, I'm glad that I got to see her talk, give us some insight, some advice as to how to start preparing, so if we get visited this year.
I came here to learn more in depth about privacy and security because as an information security officer, I have a pretty good idea of what I'm looking for on a regulatory side. But I also wanted to learn more about what the staff sizing is at different hospitals and healthcare systems and see what they are doing in terms of monitoring, auditing, and those kinds of things.
Great. Well, thank you for being here with us today.